Do Asians require a different type of eyelid surgery? I have Asian double eyelids and they have always hung low through the last couple of years. It has been getting more noticeable. I've been told by most Asians to go to a plastic surgeon who specializes in Asian eyes because they require a different type of stitch or cut from Caucasian eyes. Do I need to be concerned? And are there doctors in Austin who specialize in Asian eyes?
Thank you for your question. The concern about the anatomy of Asian eyelids and whether the concern about how to choose a surgeon is extremely valid. The Asian eyelid anatomy is very unique and has some very distinct characteristics that it's very important that the surgeon who performs this type of surgery is familiar with. Many years ago, starting from the early 90s when I began my career, I was very aware of the specific anatomic differences not only between Asians and non-Asians, but between many different ethnic groups. And so I actually wrote an article years ago called Ethnic Considerations in Eyelid Surgery. And for a long period, I was actually focused a lot on doing revisional eyelid surgery for Asians because a lot of people were getting surgery where they were having procedures where the incisions were maybe too high, too low. There was a suture materials that would actually rub against the eyeball itself. And so I was actually featured, again, going back many years ago in mid-90s on Chinese World TV and World Journal. And I can't emphasize enough the importance of understanding the anatomy as well as having experience. You see, the term Asian eyelid in itself is still not comprehensive because when I do an assessment of a person of Asian descent, whether they're Chinese, Japanese, Korean, I look at several different factors before I make a decision on the type of surgery they need. These factors include the skin quality and skin type, the presence or absence of extra skin, the presence or absence of fat. So the answer to your question is yes, you should go to a doctor who has a lot of experience with Asian eyelid surgery. Now, based on that, you can also make a distinction as to what you're comfortable with based on looking at that doctor's previous work. So you can get a sense of the particular style in which they do their surgery. From my perspective and in my experience, I feel that the desire for a double eyelid fold or a crease is basically based on a certain amount of flexibility that is intrinsic to the anatomy that nature allows. I've had many patients who came here for revisional surgery whose incisions were way outside of the natural crease that would form if they were born with the eyelid crease. And this is a very important thing that I communicate with my patients, is that if you look at yourself without the crease, and even if you have age-related changes, then you can also understand what would be natural if you were born with an eyelid crease or a double fold. You see, 50% of Asians have a crease, 50% do not. And culturally, there is a clear desire for a lot of people, and this is based a lot on the fact that fashion and entertainment, there's a lot of people who have had these procedures, and certainly it's considered desirable. But important to understand is try to stick to a natural appearance. So when you are doing your research, to just kind of summarize, it's important that you find a doctor who has a lot of experience with different types of Asian eyelid surgery, all age groups as well as different techniques. And once you meet with a doctor that you're comfortable with and you look at the results of before and afters and examples of different scenarios, then certainly go ahead and move forward with the surgery. But again, there are many factors that Asian eyelid surgery is not specifically a particular type of surgery, but it's understanding the anatomy and all the variables, as I mentioned before, of the presence or absence of extra skin, the anatomy of the epicanthal fold, the presence or absence of excess fat, the relative age of the patient, and of course the other factors that have to do with the health of the eye itself. So I hope that was helpful. I wish you the best of luck and thank you for your question.